Hi, my name is Joseph Murad, CEO and co-founder of the Swedish health tech company BYON8. My brother, me, and my father decided to start this company in an effort to go beyond the barriers of traditional healthcare and build the foundation for the next generation. After I experienced the challenges on the ground as a medical doctor in Africa, the lack of access to quality primary care was crystal clear. And not only in Africa, WHO estimates that there will be a lack of 18 million health professionals to meet the demands of primary care by 2030. But why? As over 1/3 of the world's population lack access to this basic need. Well, healthcare costs a lot of money. And unfortunately, most countries cannot afford financing a universal health cover, not even in countries such as the US. And when that happens, we become dependable on health insurance as well as the private market. And there's this constant war of attrition between insurance and providers that is causing premiums to increase in cost, which leads to most people not being able to afford insurance in the first place. Simultaneously, there is an explosion, a boom in the middle class of frontier and emerging markets. And this leads to people now living longer, acquiring diseases that weren't there before, non-communicable, like hypertension and diabetes, increasing the demands of primary care. So you have this mismatch between the increase of demand in primary care and, unfortunately, expensive and inaccessible primary care on the other side. But remember, we are here to tell you about how we can go beyond the barriers of traditional healthcare and now build the next generation. Enter BYON8. BYON8 is a web and smartphone-based application developed for over 6 years, powered by AI from the ground up to enable an end-to-end primary care experience online for the user. Chat with our AI symptom checker and figure out what's ailing you. Answer questions about your symptoms and get recommendations at a 92% accuracy, whether you should maybe stay at home, talk to a medical doctor, or even if it's an emergency. You can then continue your journey by having a chat with a doctor online, via text or video, get a prescription, and even have medication home delivered. But we can also connect you with one of our referral partners in case you should need a physical examination at a clinic or further diagnostic intervention. So, we offer convenience to the user at the same time as we are lowering the cost of care by removing any unnecessary secondary interventions. We then bundle all of this into a B2B2C subscription model to offer employees through employers. And this is a low-hanging fruit for the employer because they improve employee productivity. It's at a lower cost than traditional insurance. And at the same time, we deliver all of this at a 60% gross profitability due to the AI guidance. We are now enjoying over 300,000 users since our launch in mid-2022. And furthermore, we've established partnerships with the 3 major health insurers in the Kenyan insurance space, as well as the telecom giant Safaricom, to distribute the solution to over 40 million users in the next few years. Competition is fierce, though, in the telehealth and digital health space. But BYON8 focuses on the AI tech side to lower cost of care. We are the only AI primary care triage tool for patients in Africa. But Africa presents more than just challenges. There is opportunity, because over 25% of the world's population will be in Africa by 2050, essentially a melting pot for data and for AI. That is why BYON8 will be one of the first to own the health data itself, but not only that, build a database that is essentially unmatched on a cost per data perspective worldwide. That will allow us to compete with the very best in medical AI. That is why we go beyond. Because our belief is not only in breaking down the barriers to access affordable care, but to build the very foundation for the next generation of healthcare to the rest of the world. If you believe the future of healthcare is in data and providing affordable access to healthcare, then you are in the right place. Thank you for listening, and let's go beyond.